Hello, and welcome to another episode of McMullen Stories, the Reddit story podcast so wholesome you'd bring it home to meet your parents. As always, this episode is brought to you by McMullen Brands on Etsy. Let's get to today's story. I need to vent. I went to a large hospital health system that was sending out press releases about adult women who were ADHD but were missed during childhood. Late diagnosed due to misdiagnosed. They were putting out info and specifically targeting older women. I'm in that group and went to them expecting a focus on ADHD in women. I got two men, a clinical psychologist and a psychiatrist. The psychologist did assess and diagnose ADHD and the psychiatrist agreed. However, neither appeared to know much about ADHD or women. For instance, the psychologist who is doing my therapy for ADHD and of course depression and anxiety keeps doing things like mistaking executive function issues / task initiation issues for depression that sounds like depression. Or when I bring up issues with clutter, anxiety, and clutter getting out of control, they say it's probably distraction. It's mostly task initiation. I brought up body doubling and they asked me what that was. Granted, it's not a clinical term, but it's pretty prevalent in the vernacular and is mentioned on reputable medical sites. They also don't appreciate that I've been dealing with chronic anemia and then my doc did iron testing and I basically have no iron. The chronic anemia has been going on for years. Once we knew the iron levels were so low they sent me to heme/onc. They started iron infusions. Despite a few infusions, my numbers tanked and I went into severe anemia. I'm doing a little better, but still anemic and iron deficient. We can't figure out why. Neither the psychiatrist or the psychologist appear to understand how hard it is to have stamina. Plus, I feel like my neurotransmitters have been depleted and my ADHD and everything else has gotten worse. I also think I may not be as responsive to normal doses of meds, and my psychiatrist has been so slow to adjust dosages. He makes me feel like there is something wrong with me for not responding better. There's so much more. And yes, I know the difference between severe depression and executive function issues. I've been treated for depression and anxiety for years without improvement. I need encouragement. I think I need to ask for new providers, and I feel like being in the same system. The new providers will be biased by how these two are assessing me. Resistant and defiant? It's not just that they are menace that they aren't showing me an understanding of my issues. I don't have a good rapport with them. I actually am starting to not feel safe to open up with them. The psychologist doesn't give me info or help me understand ADHD or why and what is happening when I shut down in therapy my term. In fact, they push even harder. I had to tell them to slow down. The psychiatrist doesn't explain the medications or the whys, etc. And they don't understand the farm insurance. I work in healthcare. I actually look up the formulary and tier/costs, etc., but they ignore me. They want to do prior auths for the meds they like, however those aren't even on the formulary. It would have to be done as a formulary exception. These would be meds that the company doesn't have a volume/price reduction deal. Even if the med was approved, I'd never be able to pay my portion of the cost/copay. What's the sense of insisting on prescribing me a med that I can't take because I can't afford it? The psychiatrist totally ignores when my anxiety spins up and when I can no longer talk. It's not voluntary. They push and will say, I need to hear you say it. They know I have the freeze and mutism response. This isn't a planned exposure, it's their frustration with me and they paint me as resistant and defiant. This then makes my anxiety worse and I feel less safe. Just a really hard day and these sessions are turning into torture, not help. The psychologist has no offer of ways to help or cope. They keep asking me what they should do because they don't know what to do. This isn't trying to personalize treatment to me. They want me to tell them how to treat me. I don't know. That's why I'm going to them for help. If I do have a suggestion or guess or try to explain how distressing this is, all they do is say I see. Well, that's great, but I also need to see and understand. I'm looking things up and trying to figure things out. Some of what I'm finding talks about modifying treatment/therapy, etc. How the blank do I tell them that? Feeling really down and alone. I've never been able to think my way out of the overwhelm response once it's full blown, and I've never been able to think my way out of my exaggerated startle response. The overwhelm doesn't generally show up in day-to-day stuff. The sessions are difficult, social stuff is difficult, conflict is difficult. I know it's not rational. If it was, I would have thought my way out of it. They are pushing me to go to partial day due to the shutdowns during sessions. I don't see that this would help. I'd also lose my job. How the blank does that help? I take care of a disabled adult. What happens to them? I don't know how to try to find other providers in this system insurance issue. I need the courage to try with different providers. I am afraid that I won't work through executive function issues, procrastinating/not making the calls to find and make appointments with new providers, etc. to actually do what I need to do for myself. Doesn't help that I really hate phone calls. Sorry for the rant. I think I needed to get this out to help process. Thanks for watching. Please like this video, subscribe for more stories, and leave a comment below.